I'd like to welcome you all to the first program in our Vanderbilt COVID Commodore Classroom series, Big Data plus Privacy in the COVID Area. My name is Teresa Rogers, Associate Dean for Development for the School of Engineering, and I want to thank all of you for joining us in today's discussion. We are honored to have Dean Philippe Fauchet, the Bruce and Bridget Evans Dean for the School of Engineering, as our moderator today, and our panel of distinguished panelists from Vuit, Engineering, Vanderbilt Law School, and Owen School of Management. Thank you all for attending, and now I'll turn things over to Dean Fauchet to begin our program.
Thank you, Teresa, and hello and welcome to this panel discussion on big data plus privacy in a COVID era. As Teresa said, my name is Philippe Fauchet, and I'm the Dean of the School of Engineering. Before we start the panel itself, I want to acknowledge a shortcoming of this panel. It's an incredibly distinguished panel that we have today, but it's not as diverse as it should be. We had sought other panelists as well, but they were unfortunately not available today. I want to take personal responsibility for this shortcoming, and I pledge that we will all work together to make sure that the panel for the next COVID Commodore Classroom series presentations better reflect who we are at Vanderbilt and who we aspire to be. Today's webinar is a timely conversation about the risk-reward proposition of using big data to help stop the spread of COVID as we weigh our individual liberties. With many institutions, businesses, and communities relying on contact tracing and epidemic tracking models to reopen safely, what already has and will become our new normal? And who is determining that? And how is Vanderbilt uniquely positioned to contribute to this important conversation? So today's panel will focus on a few very big and important questions. For example, the complex interplay of healthcare economics, law and justice, and technology. The very difficult situation we are experiencing today requires us to understand data, reliable data, and trends in data. It requires us that we understand the power and threats of technology, for example, with respect to tracing. It requires of us that we get an appreciation of the trade-offs when it comes to liberty and privacy, health, and the economy, and also that we understand what the law actually says. And finally, I'm sure that most of you are very interested in learning what Vanderbilt is doing and how its IT department works to guarantee that our data is secure. With this, I would like to introduce the four panelists. Thank you. And I will introduce them, and they will introduce themselves briefly for about 30 seconds, one after the other, before we go into the conversation. First, Larry Van Horn, who is an Associate Professor of Health Economics and Executive Director of Health Affairs. Larry Van Horn is an expert in healthcare economics and is currently tracking COVID-19 and related healthcare consumption for the White House. Larry?
Thank you, Philippe. It's a pleasure to be with you. Philippe and I have known each other a long time, and I've been at Vanderbilt for 15 years. I'm a health economist, and I spend my time researching issues in health economics, but more germane to this, analyzing healthcare administrative claims data that's the byproduct of our consumption of medical care. And starting in March, I was asked to provide a daily data feed to the administration to facilitate their planning and response. And I will spend some time showing you what we see and how healthcare consumption has changed in America and how COVID-19 in particular has changed across the country.
Thank you, Larry. The second panelist is Jules White, who is an Associate Professor of Computer Science. His research focuses on creating next-generation mobile and cloud applications that are secure, efficient, and scalable. Jules?
Thank you for having me. So my focus is on how do we take our mobile phones and have them sense the world around us and try to help make decisions or help do things that will improve our lives. So I work in a variety of areas, from indoor positioning of helping patients in a hospital, for example, to do something simple like find their way to an appointment, to augmented reality and doing more complex things like being able to show you information about a complex construction project in front of you. And so some of the areas that I do work in, particularly indoor positioning and mobile computing, and how do we secure those things, directly intersect with the COVID contract tracing applications through mobile devices. And so I'll talk about that.
Thank you, Jules. Next is Chris Slobogin, who is the Milton R. Underwood Professor in Law, also the Director of Criminal Justice Program and an Affiliate Professor of Psychiatry. Slobogin has written over 100 books and articles on criminal justice matters, including the use of big data in connection with privacy policy and sentencing. Chris?
Hello, everyone. I've been writing about big data and government use of big data for quite some time. Back in 2007, I came out with a book called Privacy at Risk, the New Government Surveillance and the Fourth Amendment, and I've been interested in that topic since then. Right now, I'm working with the American Law Institute on coming up with standards governing government use of and access to big data. But also today, I'm going to rely to some extent on my background in criminal justice, talk about the extent to which government can exert its power in pandemic situations like we have today.
Thank you, Chris. And our fourth panelist is Masoud Sidiquar, who is the VUIT Director of Security Operation. Masoud?
Hello, everyone. Thank you, Dean Fauchet, for the opportunity to allow me to join the esteemed faculty members here on the panel and share my insight in terms of what Vanderbilt is doing to address cyber-related threats. I have been working in this field for the last 16 years, the first 6 within the Department of Defense as a contractor, and I've been here at Vanderbilt for the last 9 years.
Thank you, Masoud. Now, after these short introductions, we will hear from each of our panelists about their research and practice in this area, as well as we'll have some Q&A sessions based on the pre-questions that you submitted, which actually have helped shape our discussion today. So the first presentation will be by Professor Larry Van Horn.
Very good. Well, thank you very much, Philippe. I am going to spend a few minutes giving you all an overview into what we see in medical claims data in the United States. It gives us a real-time visibility into healthcare consumption and how it's changing. And it reflects approximately 50 to 60% of all commercial health insurance claims in the United States. The first point I'd like to show is this is visualization showing 2 weeks, the week of February 8th on the left and the week of March 7th on the right. This is showing relative to the first week of January, the growth in respiratory conditions across the United States, of respiratory diagnosis. Prior to April 1st, we did not have an ICD-10 code to codify COVID-19 specifically. So we were tracking about 84 codes that could appear that somebody might code a COVID-19 diagnosis as. And what you'll see here is if you look, even in early to middle February, there were areas where there was huge expansions of respiratory conditions across the country. South Carolina, North Carolina, over into West Virginia, Northern Kentucky, or the southern part of the United States. And then as you went into later on in March, this is all prior to the nation's shutdown, hotspots in the center part of the country, Missouri, and then up in Washington State and Oregon. My point in raising this is that some have suggested, and the data I think supports this, that COVID-19 was present in this country and prevalent much earlier than when the nation took its response on March 15th. This is a graph showing the claims starting on April 1st for COVID-19 across in the United States in the commercial population. You can see, and so we couldn't codify it specifically till April 1st, so that's why this starts on April 1st. But of note, you see it's growing. It peaked around the end of May 21st. This is Memorial Day weekend, and then it continues, and it drops a little bit in the last 2 weeks up through the end of last week. So there is a little bit of a downward trend. What's noteworthy here is there's a lot of data out on COVID-19 and cases and tracking and whatnot. What I'm showing you here is a somewhat different picture because it's from people who've actually been diagnosed with COVID-19 who are sick. They went and consumed medical care. Many people who have been tested are asymptomatic, and they're not going to show up in this data. So these are these sick individuals. There's a lot of variation underneath that national picture, however. I have 4 panels here of selected states that are showing increases in the weekly rate of COVID-19 sick individuals who are presenting to the healthcare system. So Texas, top left, Arizona, top right, Florida, bottom left, and Utah, bottom right, all experiencing a consistent increase in the rate of individuals presenting to healthcare in receiving a diagnosis of COVID-19. But similarly, we have states that are going the other direction. Top left is Illinois, that peaked around May 14th and has been trending downward. Pennsylvania peaked the week of June 11th and is precipitously dropping in Pennsylvania. Michigan on the bottom left peaked around May 14th, has been trending downward, and again, Maryland peaked around June 4th and has been trending downward. So the point of this is that there's a lot of statewide variation in the individuals who are presenting to the healthcare delivery system who are sick of COVID-19. Now, one of the most striking things that happened in the United States is on March 15th in America, a day that will live in infamy right here, is when we issued many of the stay-at-home orders across the country, and we started eliminating healthcare volumes to prepare the delivery system to have available capacity to serve the needs of those with COVID-19. This was normalized. One is the baseline to pre-March 15th timeframe. This is basically what was the volumes today relative to volumes in February. And so we're clicking along, and then we basically scrub out the volume in the United States. Blue is hospital ED, red is hospital outpatient, and green is office. So the volumes dropped all the way till April 17th, where we had basically eliminated about 60% of the pre-COVID-19 medical care in the United States. That is a massive shock to the system. And this is when we cratered. The bottom is really around April 17th. And then since that point in time, volumes have been returning nationwide. And so we are up from losing 60% of our volume to today, nationally, we're down about 25% in terms of office visit volumes to pre-COVID levels. So volumes have been returning over time. But again, this masks important variation underneath. We're sitting here in Tennessee. We cratered and dropped to around 50% of pre-COVID volumes the week of April 17th. But we've returned most of that volume. We're down around 20% from our pre-COVID period. Office visit volumes have returned. ED visit volumes still remain off quite significantly. But you can see we'll have these peaks and troughs, and this is all medical care. This is not just COVID-19 diagnosis. This is all medical care consumption. And this has imposed a very significant financial challenge on the U.S. healthcare industry, as we've eliminated much of the volume in the United States, which is what supports the economics of healthcare delivery systems. Contrast Tennessee with Massachusetts, which had a much more significant volume drop, down to around 70% in the week of April 17th, but they have recovered very little. It's a much slower rise in Massachusetts in return to volumes. So this is clearly going to be imposing a financial challenge on the delivery system in Massachusetts when their volumes are off about 50% pre-COVID. Contrast that finally with Utah. Utah only dropped around 30% from peak to trough, and they're back close to where they were in terms of pre-COVID volumes. So there is a lot of statewide variation here, both in terms of the COVID prevalence, the rise and fall over time, as well as the economic cost to the delivery system from eliminating volumes. So in summary, March 15th is the day that healthcare changed in America. We saw anywhere up to 60 to 70% elimination in elective volume across the United States. That translated into approximately 1.4 million healthcare providers losing their jobs or being furloughed in the midst of a pandemic. The trough appears in the data to be the week of April 17th, and we're tracking on a daily basis how healthcare volumes are returning. One of the important points of this view into the COVID data is that it reveals individuals who are sick, not the walking around asymptomatic who have tested positive. And we see significant variation across the United States, both in terms of COVID cases, but also volume responses to medical care. So there's a quick overview, Philippe. You're on mute, Philippe.
I say thank you very much, Larry. I think that it's really important that people know what the data show, and this country is a very diverse country, of course, and so it's not necessarily surprising that different places have very different profiles. Let's move on to technology and mostly probably mobile technology with Jules White. Jules?
Yeah. Great. Well, I'm going to talk a little bit about the contact tracing, which is close to my area of research. So if you think about the mobile phone, one of the things I tell my students in my security class is, imagine that I was going to do a research study and I told you that I was going to have you put on a set of sensors and they could measure all of your movements. They could record everything you saw, everything you said. They could know all the people around you, who your friends were, see every email that you sent, every text message you sent. They could track sleep patterns, all of this stuff. What would you ask me about the security and privacy of that sensor system and how I was going to collect that data? And of course, everybody asks questions. And then, of course, the punchline is, well, how many of you actually bothered asking these questions before you bought your last mobile phone or before you installed an app on it? And did you pay any attention to that? And inevitably, nobody has paid any attention. But when we think about mobile computing and these phones that we're carrying around and their capabilities, if we took one of these phones back 20 years, it would be one of the most powerful supercomputers probably in the US. Or you go back 30 years and it certainly would be. So we've got really sophisticated capabilities, and these phones can sense everything that's going on around us. So we have a lot of sort of concern about how we secure these things. But on a daily basis, we go about relying on them to help us make basic decisions. Everything from healthcare decisions to how we get to work. And every time we do that, we essentially make a trade-off. We are giving up some of our data, we're giving up some of our privacy about what's going on around us to one of these companies that's providing us this service. And so most of these services, when we go and get apps and we're using them, they're free. And part of the trade-off is basically that we are agreeing to give up our data generally so that they can try to sell us things and do a better job of selling things. And me personally, I tend to be very happy with this trade-off. You can try to sell me things all you want, and I will consume your services. And so a great example of this is it's difficult for me to go on a road trip or go anywhere else without pulling up Google Maps. And I find Google Maps to be absolutely essential to find out how to get somewhere because it tells me real-time traffic information. And so I'll be driving down the road and on the highway, and it will tell me, okay, well, there's a traffic accident up ahead. We're going to route you around that. Or there's significant traffic. We're going to give you an alternate route. And this is a really big deal. I'm getting a really valuable service out of this. But the way that Google Maps is doing a lot of that traffic analysis and other things is by looking at my location, looking at my speed, where I'm going. And so I'm giving up information about my daily life, where I'm going, what I'm doing to Google in exchange for getting access to all of this traffic data. And a great example of this is this picture that I've got here on the slide. This was a performance artist who bought a bunch of old Android phones, put them in a wagon, and signed them all into Google Maps, and then walked very slowly down some streets in order to draw traffic onto the map. So he basically spoofed Google Maps into thinking that there were traffic jams, and he could draw lines across the map of the city that were all red by basically pulling this little wagon of phones around. But it also shows you that, you know, every time we put our phone in our pocket and go somewhere with Google Maps or the weather app or whatever it is, we're actually giving up information about ourselves that they use for the collective sort of analysis, the big data analysis that then helps it, provide decisions back to us. And so this might be something simple like maps, or it may be something more sophisticated like the Apple Watch trying to detect irregular heartbeats, or potentially trying to detect other things that could be important related to your health or life, helping you with social things with friends. All of this is basically a contract that we're entering into. And most of us don't think about the security and privacy enough, in my perspective, about this on a daily basis. Now, where this gets really interesting with COVID is one of the problems if you get COVID and they want to contact trace and figure out who you were around when you were symptomatic or when you could have spread it to somebody else is, they need to know who was around you, who did you interact with. And I can guarantee you that if you asked me on a day before COVID, who all did you get in proximity to and could you have possibly infected, I would have a really hard time remembering this, particularly if it involves thinking about, well, who were the people around me in line at the grocery store? Did I really social distance when I was standing waiting at the crosswalk? And do these people need to be notified? And probably I don't remember that information. And so one thing that I have to give Google and Apple credit for is they did something really interesting. And they said, well, what if the phones could, in a fairly privacy preserving way, remember the other phones that they were around and then inform them? So if you get COVID-19 and you want to let the other people know, if you want to, that they were potentially exposed, is there a way that your phone can broker that exchange and remember what other phones were around you and then let the owners of those phones know that they were potentially exposed to COVID-19? And so what Google and Apple tapped into was actually something that's been used quite a bit for the indoor positioning research that I've done in the past, but also it gets used a lot in retail settings, which is the Bluetooth on your phone. So your phone can basically receive Bluetooth signals, things like these earbuds that I'm wearing right now, or your Apple Watch, but it can also get signals from all kinds of other devices. So in retail, for example, they will put out little Bluetooth beacons either in the light fixtures or around products in a store. And then many of the large retailers, when you are walking around with Bluetooth on your phone and you have their retailer's app, as you're walking around, they are identifying which products you are close to in the store. And basically, as you're moving around, they're figuring out, well, they went and they stood in front of the TVs for 30 minutes. Maybe we need to go and push them a coupon for a TV because they didn't buy a TV, but maybe there's an opportunity. And so there's been a lot of this use of this technology in a very non-privacy preserving way, in a very tracking you type of way. And basically what Google and Apple have done is built a framework that allows them to tap into the same type of thing, but actually they've built it in a way that is privacy preserving to a great degree, similar to what you would have with contact tracing. So the way that this works is if you have their app, although later maybe be built into the phones automatically, your phone is sending out with the Bluetooth on a signal that's basically a random identifier. And it's remembering every random identifier it's sent out. And as you're walking around throughout your day, the other phones around you can record that random identifier. Now, they don't know who it is that's sending it out. They don't know your identity. And if they ever were around you again, that identity would have changed on your phone. So it's continually changing so that you can't have another person tracking you with this. And then if you ever get COVID, basically you have the option to agree to upload all of the random identifiers that your phone sent out to a central server, to where they can notify and everybody else can get access and say, if you've ever seen this identifier, it means that you were exposed to somebody with COVID. And they don't, when the identifiers are uploaded, it's not giving up your identity or your name or anything like that. All it's telling the people that get access to it is, if your phone has ever seen one of these identifiers, it means you were potentially exposed to COVID. Now, this is very similar to what would happen if you got COVID and you had a human contact tracer ask you, tell us all the people that you've been around. And then they would go and inform those people you were potentially exposed to someone with COVID. So Apple and Google have actually done a really good job about reversing the typical trend, which is to suck up all of your data and use it to sell you things. And they've actually built a very privacy preserving framework to allow you to opt into letting other people know that they may have been exposed to you with COVID. So it's kind of similar to masks. This is really not necessarily to protect you per se. It's really about you opting to give up those identifiers so that people that could have been exposed to you can know that they should isolate, and that they may, if they have loved ones who are at high risk, they can isolate from them, or they can go and get tested. And it's giving sort of the same controls that you would have if you were talking to a human contact tracer and saying, yes, these are the people I was around, and maybe they need to know about this. They could go and tell them. And so it's a very similar model. From a technology perspective, I won't go into a lot of the details, but the way that they've designed it has really gone to great lengths to protect your privacy. And the access that they're getting to this data is not any greater than you would get if you had a human contact tracer going and collecting this information about you. So it's really kind of an interesting thing. Now, one of the things that's interesting that I think about this is that they've been able to develop and design the system to be very privacy preserving. Of course, I think there's always a balance with government of trying to write laws that make it harder for them to design things in a privacy preserving way, or to encrypt things so that you can hide things. There's always a desire by government to often write laws to make it easier for law enforcement, for example, to get access to these things. And so this is one of the things that we're continually dealing with when we have this type of big data collected about us, is we have the technology to protect a lot of the information, but we have to make sure that from a legal perspective, we have the laws in place that properly balance sort of our right to privacy with the sort of greater benefit to society and law. Thank you.
Okay, thanks, Jules. This is a great introduction to the next presentation, which is going to be by Chris, and we'll touch on the law, liberty, privacy, and COVID. Chris?
So thank you very much. Actually, what Jules just said is a nice segue into what I want to talk about. I'm going to be talking about the implications of legal precedent for the COVID crisis. As Philippe said, the crisis obviously has huge implications for health and the economy and liberty and privacy. As a number of the questions that you all sent in before this panel indicated, these three areas can all be in tension with one another. If the only concern is preventing death from the virus, the economy will end up in tatters, and there'd be serious infringement of personal liberty as well as privacy. If, on the other hand, reviving the economy is our primary goal, death and sickness rates will probably soar, and if protecting liberty and privacy is our dominant aim, we will be severely limited in both our ability to contain the virus and safely revive the economy. So here are the three values I think that are in tension with one another. And the law has something to say about all three parts of this pie. Let's start with health. How far can the government go in protecting it? What lawyers call the leading case on this issue comes from way back in 1905, Jacobson versus United States, the United States Supreme Court opinion. There, the court upheld the criminal conviction and fine of a person who refused to be vaccinated for smallpox. Jacobson claimed that being forced to undergo a vaccination violated the liberty guaranteed by the 5th and 14th Amendments of the U.S. Constitution, but the court disagreed, stating that as long as the vaccination program was approved by the legislature and was based on accepted medical opinion, the smallpox program was was constitutional. More specifically, the court said what you see here. Even liberty itself, the greatest of all rights, is not unrestricted license to act according to one's own will. Upon the principle of self-defense, of paramount necessity, a community has the right to protect itself against an epidemic of disease which threatens the safety of its members. So Jacobson announced the idea that liberty can be restricted to prevent harm to the community if the restrictions are necessary in light of the harm. To put this in terms of a very oversimplified benefit-cost equation, this means that the preventive benefits of a given intervention must be greater than the cost of the intervention to other important interests, taking into account the impact of other possible interventions. So, going through a number of possible interventions, given what we know about the harm caused by the virus, could the government force all but essential workers to stay home? That intervention might significantly minimize deaths, but the cost would be enormous, economically, psychologically, and socially, so presumably not. The government couldn't do this, especially given the availability of other alternatives. One of those alternatives is forcing those who are known to be infected to stay home. Is that permissible? Probably so. Jacobson noted with approval a case in which a person with yellow fever was forced to stay on his boat until the danger of infection disappeared. How about forcible vaccination? If, for instance, not vaccinating people would threaten children who would otherwise be harmed. So once again, probably this is permissible. This is the precise issue that was dealt with in Jacobson, and Jacobson said it would be permissible to do this. Of course, a vaccination does not yet exist. So in the meantime, how about forcing people to wear masks? That obviously does not do as much as quarantine or vaccination to limit harm, but given the minor inconvenience of masks, it probably is also permissible. Finally, business lockdowns are probably okay as well, although because of their effect on the economy, the analysis is much more complicated, and I'm going to say a few more words about that in a moment. Now, one thing that you often hear from folks who don't want to submit to this is, well, we don't know for sure if vaccination or masks or lockdowns will work. Jacobson, the Supreme Court case, said this about that objection. As you can see it here, the possibility that the belief may be wrong and that science may yet show it to be wrong is not conclusive. For the legislature has the right to pass laws which, according to the common belief of the people, are adapted to prevent the spread of contagious diseases. So actually, Jacobson is pretty accommodating to the various kinds of interventions I've been talking about, but it did express two limitations which are important to emphasize. First, the necessity decision, the decision that the intervention is necessary, must be made by elected officials or their delegates. A decision by bureaucrats alone won't pass muster. And secondly, once the program is authorized, it must be applied in an even-handed manner. As Jacobson put it, the rule must be applicable equally to all in like condition, which means, for instance, it has to apply to lawmakers and their most powerful constituents, as well as everyone else, which is a rule that probably would tend to limit oppressive enactments. So going back to the kinds of interventions that might occur, what about those that Jules was mentioning? Actually, the kind of interventions that Jules talked about seem to be pretty privacy protective. So to make it a little bit more draconian, what if the government forced individuals to give up their personal information about location and so on in order to identify disease clusters and track who might be affected and let people know they need to seek testing and wear a mask? Again, one has to ask how much this invasion of privacy minimizes the threat posed by the virus. And here, those who want to protect privacy can bolster their case by pointing to two other Supreme Court decisions, much more recent than Jacobson, that hold that under the Fourth Amendment, people have a reasonable expectation of privacy vis-a-vis the government with respect to their location and identity. So in Carpenter versus United States, the court held that the government needed a warrant to get location data from Carpenter's cell phone company. And Jones versus United States, the court held that a warrant was needed to track a person's car in real time. Would a warrant also be required with COVID tracking, assuming it's non-consensual and people are being identified? Perhaps, but perhaps not. If all tracking does is identify people who have been exposed to the virus. In other words, it might be enough justification under the Fourth Amendment if the government has reason to believe that the people targeted were exposed to the virus. And this is a question a number of you asked. What about the government accessing medical records to learn about the spread of the virus and related matters? Can it do so without consent? All of you have heard of HIPAA, which is meant to protect the privacy of health records, federal statute. However, HIPAA has a huge carve-out, which applies when disclosures, quote, are required by law, which could include legislation dealing with the virus. The same is true of the General Data Privacy, or Protection Regulation, the GDPR, Europe's well-known privacy law, which a number of you asked about. In most cases, this law is very privacy protective in the absence of consent, but it has an exception if processing information is necessary to protect against, quote, serious cross-border threats to health, which presumably applies in this situation. At the same time, the necessity principle still applies under the GDPR, even if health or other privacy information, other private information is considered necessary. How much information is necessary, who gets to look at it, and how it's used are relevant considerations. So for instance, European authorities applying the GDPR to the virus situation say they will enforce the provisions of the GDPR that limit access and require data minimization, data security, and limits on the use of data for approved purposes. So what does that mean? Well, it's been interpreted to mean, for instance, that companies can ask employees whether they're infected, whether they've been to high-risk areas, whether they've been exposed to infected people, but employers cannot take employees' temperatures upon entering a building. Plus, employers cannot notify other employees, they can notify other employees about the risk, but they cannot identify the risky employee. Similar in impact is the California Consumer Privacy Act, or CCPA, which is California's privacy law, and it's the most protective in the country. However, in contrast to the GDPR, apparently under the CCPA, the employer may take the employee's temperature so long as the information obtained is used solely for virus fighting purposes. So there are a lot of different approaches under the law to health privacy. Finally, you'll notice I haven't said very much about the economy, which is the third piece of the pie. Is the lockdown's effect on the economy relevant or as relevant as health and liberty and thinking and privacy and thinking through all of these issues? It certainly is in other areas of the law. Regulatory policy in the environment, for instance, requires that proposed pollution controls take into account economic impact under the executive order you see here. But obviously, this analysis is very complex. All I'm going to note here is that loss of life can also have an economic impact. A professor at Princeton has provided an algorithm that allows the user to enter various values associated with loss of life given various lockdown and testing policies. He notes, for instance, that extensive lockdowns might be worth more than $30 trillion in lives saved. Although he also notes that the amount, that amount of $30 trillion might be much less if most of the lives lost were over 80 or other variables are considered. It's worth checking out this algorithm at the link you see here. So I think I'm going to end with that. I think I've helped explain how difficult this decision-making is and what the law has to say about it. Thank you.
Thank you, Chris. And now Masood will tell us what he can tell us about what we are planning to do on campus in terms of privacy and related to COVID. Masood?
Thank you, Dean Fauchet. So we've talked a lot about the various trade-offs in terms of making personal information available for a greater good. Unfortunately, when it comes to the bigger picture, it's not always authorized agents or agencies where there's a trade-off involved in terms of access to data and a service rendered. There are a lot of cyber criminals out there who are equally interested in the data for to advance their cause without really much of a service rendered or returned to the individual. So the challenge of protecting sensitive data, which includes private information, is as complex as it is important. There are no silver bullets, and nobody has it figured out. And managing cyber risk, it is a priority for Vanderbilt, and we've made measurable progress on this front. And so, before I share some of the steps that we've taken, I would like to provide a quick overview of some of the ways that cyber-related risk can impact our lives and in our world. Cyber-related risk can impact our privacy in ways that not long ago weren't possible. It can impact the place of our employment, the communities that we're parts of and members of, as well as the entire nation. And these risks aren't restricted to just data and dollars. They can actually transcend and enter into the kinetic world and cause impact and risk in a completely different way in terms of life and safety. And some of you may have read headlines around cars being hacked and so forth, and whether it's electric grid, and there will be more of that, and there have been instances of it. And higher education is not immune to these threats. In fact, due to the sheer volume of data and some of the specialty data that we have in terms of research data, makes us unique targets. So does Vanderbilt see any activity on this front? We do, in fact. As you can see here, on a daily basis, we detect over 1.7 million attacks daily. And so what are we doing to sort of help manage some of that? It's a three-pronged approach: prevention, awareness, and response. And if it sounds a little like firefighting, there are some similarities between the two. On the prevention front, we use next generation firewalls, intrusion prevention systems to prevent common attacks, as well as multi-factor authentication. And in the last couple of years, we've greatly added to our tool sets, not just the dual multi-factor authentication that I mentioned, but we've enhanced our intrusion detection system, our network forensic platform, and substantially invested in our continuous monitoring system, which I'll talk about a little later on. But a lot of this assumes that our users and our devices are on campus. But as we all know, COVID-19 changed that configuration. It shifted the devices and the users, not just off campus, but really anywhere in the world, right? And so we shifted our focus from the devices and users to really access to key sensitive data, the key repositories that would be of most impact to Vanderbilt. And the best technology to help accomplish that is multi-factor authentication.
Looks like you might be frozen.
Sorry about the technical difficulty. Can you all hear me?
Yes.
Excellent, thank you. So we've really focused on access to the data itself with multi-factor authentication because it's easy for scammers to get a hold of your VUNet ID and password and try to log in as you and access the data that only you should have access to. So since March, we've secured 14 plus applications with multi-factor authentication, and 3 of those applications are listed here: Yes, Brightspace, and Microsoft Office 365. And so protection is great, but needs to be supplemented by increasing awareness on campus. We have already seen COVID-19 related email scams and expect this to increase and continue when the semester starts. We've been using a number of different communication channels to reach out to our community members and share our observations with the end goal of increasing awareness and helping them understand what they can do to protect themselves. We are working closely with campus partners and at the leadership level to make online cybersecurity awareness modules available to everyone. And so this is one of the partnerships with Dr. Jules White here that was really, really helpful and something that we enjoyed and look forward to doing again. Security experts believe that there are two types of organizations, those that know that they have been breached and those that do not. And so in the security industry, we use a metric called dwell time, which measures the time between an attacker gaining access to an organization and the organization detecting that unauthorized time. And currently that dwell time is about 6 months, which is plenty of time for the attacker to do significant damage. By the way, in that Marriott breach that some of you may have heard or read about, this dwell time was 4 years. It took them 4 years to understand that their environment was breached. Now, all organizations will get breached, and the ability to quickly detect and respond to the issue will minimize the impact. This is a lot like the smoke going off, and how soon after the smoke that you're able to actually detect it will help you control the fire. And so this is an area that, much like the rest of the industry, that we've really been focused on in fortifying our detection and response capabilities, because we can't, and nobody can look at all 1.7 plus million alerts in any meaningful way. That is just not possible. So what we're really doing is investing in really fine-tuning our continuous monitoring platform, which is based on a security analytics platform. And what this allows us to do is take that 1.72 million attacks and apply our secret sauce, which comes in the form of, okay, how severe are these attacks? Focusing on the most severe attacks. What is our confidence level in terms of those attacks actually being successful in materializing? What are the targets in terms of what are the vulnerable assets that are being targeted? How important and significant are those? So when we put all of that together, it really helps narrow it down to about 20 plus on a daily basis that we have to look at. Now, that doesn't mean that, this is foolproof, that there isn't a 21 or 27 that perhaps could be more important, which is why this is an ongoing process, but it does make it a lot more manageable. And again, this is an evolving landscape that involves adversaries ranging from sort of enthusiasts to state-backed threat actors. And we will continue to monitor the changing landscape and work closely with our partners and community members to take reasonable mitigation steps. So thank you for allowing me to share what we are doing to address cybersecurity-related risks.
Thank you, Masood, and thank you all the four panelists. Now we are going to have a fairly brief Q&A session, when I will ask questions inspired by the questions we received from you. And the first question is probably a very big one. What we are experiencing through this pandemic is a very significant shock to the system, where practices have to change completely. We are actually doing something right now that we probably were not going to do 10 years ago or even 5 years ago. So the question is really related to the healthcare industry. What sort of changes do you predict or do you see happening right now, and what kind of further changes, both in delivery of healthcare but also in the economics of healthcare, can you see due to this pandemic? Maybe I'll start with you, Larry.
Sure. One of the most striking changes that we observed occur in U.S. healthcare delivery following March 15th is the rise of telemedicine. I'm sure that many on this have had telemedicine visits. What happened was a change in regulatory environment and payment policy that massively increased telehealth. There was about an 80-fold increase in telehealth utilizations pre-post-COVID. And it's being used for all kinds of healthcare delivery in ways that had never been anticipated previously. It did not substitute for all of the lost volume. Approximately 20% of the lost volume was shifted to telehealth. But I believe that the move to telehealth is probably the most significant and likely permanent component of what healthcare delivery will look like in the future. We've seen it come down from a peak. It's down about 30% from its peak in terms of its utilization. But I would forecast that the most significant change in healthcare delivery as a result of this is the move to telehealth. And that will have implications for provider economics, because when we're doing telehealth visits via Zoom or whatever platform, DoxyMe, you name it, in healthcare, we're not consuming as many of the ancillary and technical components of medical care and visits that has driven provider economics historically. So the industry is going to have to change their business model to embrace telehealth on a go forward.
Great, thank you. Anybody else wants to add something before we move on to the next question? No. Okay, the next question I'll address to Chris first, and then everybody else can jump in after that. And the question reads, should legal privacy restrictions be lessened if knowledge learned is for the greater good? And also, how do you determine the validity of the greater good?
Oh, that's a huge question. And to some extent, the Fourth Amendment is the constitutional provision that's most relevant to this. The government always gives more information. The government's been trying to exploit big data ever since it came into being. And of course, the government argues it's for the greater good to have this data. We can fight crime better, cybersecurity risks of the type Masood was talking about. We can fight other kinds of crime better, child pornography and so on. And we can facilitate responses to public health threats like we're dealing with the virus. But obviously the downside is all this information can be abused. So what the Constitution suggests, as I mentioned in my remarks, is that there be a showing of necessity before the government accesses information. And if it's private information linked to a particular individual, there needs to be some specific justification for getting that information. So those general principles have to be applied in each context. And as I talked about in my remarks, there are a lot of different contexts, whether it's mask wearing or quarantine or contact tracing. Each of those situations has to be analyzed separately.
So I'd like to jump in as well on this one. So I think that you have to be very careful with creating regulations that limit what you can do from a technological perspective. So for example, there's the Earn It Act that is trying to be passed by Congress, essentially to provide a backdoor for law enforcement into encryption. And so it certainly has a noble, sounding purpose, but I think we always have to be very careful when we hand over the key to all of our privacy to government, because we have to make sure that they can actually protect it. So a great example of this, I think, of the risks are TSA mandated essentially that all locks on suitcases had to have a common key. And then they talked about this, had a press event where they had gotten this done, and they held up the key. And some smart people realized, they're holding up the key. All we have to do is take a screenshot of that, and they were able to replicate the key and then publish, plans to 3D print the key on the internet. And so anybody can go and now unlock those suitcases that have that TSA spec for the common key. And I think we want to be very careful that we don't end up with some regulation that mandates the common key to all of this data that the mobile devices are collecting about our lives, and then have it escape onto the internet because it wasn't exactly thought through that well. And I also think just having that one key in one place is also a very risky thing. If you think about the Office of Personnel Management, that have all of this data on government employees and people who had, top secret clearances, and then it was suddenly hacked and released, or Equifax. And so I think it can be very difficult when we have those types of backdoors to protect them if they get, legislated in.
Yeah, I'd like to ask a follow-up question, and I'm not exactly sure who among the four of you is the best qualified to answer it, but we are talking about, for example, Jules, in your presentation, you showed how cell phones of two people who are sitting next to each other can be used for tracing people who have been exposed to COVID-19, and all sorts of other applications isn't that likely to increase the disparity between the haves and have-nots in this country, to really magnify, to make really a subclass of people who don't have access to technology and therefore don't have access to being warned if they've been exposed and so forth?
So I definitely think there's the risk of that. Anytime I think you rely on mobile technology, you certainly run the risk that the people that don't have it or who are less, adept users of the technology are going to be left behind to some degree. There's also the possibility that it can be used to, allow human contact tracers and things like that to focus more effort on that population. But I think in general, there is a huge risk that certain people are left behind, or, my not having the best iPhone means that I don't get as good of exposure notifications. That is a problem.
All right, we only have a few minutes, and I will ask each of you to do a closing statement or share with us what is next on your agenda or the most concerning. And Masood, since we didn't get to ask you a question directly, as you know, all our undergraduate students are coming back to campus in about 2 months. What keeps you awake at night?
Receiving emails, clicking on links, because while some of it has happened, expect to get a lot of emails that'll say, look, you were exposed, click here to find out the details, provide this information so we can confirm your status, or we need you to complete this symptom monitoring survey and so forth. So expect a lot of that aimed at gaining information, gaining access to your personal information.
Okay. Larry?
Sure. I think it's important that we acknowledge that there is a relationship between economics and health. And as we have imposed a significant economic downturn in the US economy, generating almost 40 million new individuals who are uninsured, who are income insecure, who are worried about their ability to pay their bills, we have research that shows that there's a very strong relationship between one's economic health and their physical health. And so I think that's a narrative that has not been well articulated. And we need to get the balance between our economic health and the direct relationship that has to our physical health into the conversation as we manage the trade-offs around COVID-specific health consequences.
Thank you. Chris?
So I guess if you want me to talk about my biggest fear for the future, I might have to identify the public-private relationship as a major concern. Government has increasingly begun to rely on private companies in obtaining information about its citizens. What I mean by that is, for instance, relying on Google, Facebook, common carriers like Verizon to get information, data about individuals. Jules has talked quite a bit about this, and there needs to be much more thought given to how that works, which we are trying to do right now. But right now, there's very little regulation on that particular topic.
Jules?
I think that, there's a lot of potential to use technology to help with things like we're seeing, like contact tracing. And I think a lot of it is going to have some privacy trade-offs. So I think there needs to be more sort of work done to effectively communicate what it is you're doing for society. If you agree to opt into this, how will it really help and benefit other people? And then also make sure that we have sort of legal and regulatory frameworks that allows us to design these systems in a way that we will all trust them and feel comfortable if we do want to opt into them to, donate essentially our privacy to some degree or some data or something to help everybody else.
Well, I'd like to conclude this panel by thanking the four of you for the incredible insights and perspectives that you brought today in this discussion. I'd like to thank the audience for joining this very important discussion today. It's an important time in this country, and I hope that you enjoyed and you learned something from the panelists. So to conclude this, and if you want to show the last slide, this was the first of a new series, the COVID Commodore Classroom series. The next one will be focusing on health disparities on July 15th, and it will be moderated by Dean Emily Towns of the Divinity School. The registration for that meeting can be found at vuconnect.com. And with this, I would like to thank everyone again for participating and for listening, and I wish you good health. Thank you.